Hello everyone, this is Dr. Latha and today we'll be having a small talk on genetic testing. Every parent hopes for a healthy baby, isn't it? But the journey from planning a pregnancy to meeting a healthy baby is not always easy and straightforward, especially for those who will be facing an emotional turmoil because they've had any family history of genetic conditions. Now, having said that, is there any way to detect if the baby can actually be affected with one such genetic condition? The answer is yes, for most of the times. And these tests can be broadly categorized into those that are done even before planning a pregnancy and those that can be done during the pregnancy, which most of you would have come across. Now, tests that are done before pregnancy can include the parental testing, meaning parents can look normal, as in they might not have been affected with such genetic abnormality, but they may have any faulty gene and they can be transmitted to the future generation. And hence testing such parents through blood or saliva samples broadly might be of help. Or the other situation may be any known family member being the close relative or any other family member might be affected with one particular genetic condition, and hence the testing of the extended family members for such conditions might also be helpful to understand the pattern of transmitting such condition to the baby as well. And the other one which has evolved over years and which is most popular these days is the pre-implantation genetic testing, for which the eggs are retrieved and the sperms are also taken and they may be made to fuse artificially in a lab outside, which we in general called the IVF technique. And in this technique we'll have embryos available and then we can detect if they are normal or abnormal, and we can take these normal embryos to be planted in the womb, and then hence it can be allowed to grow into a baby, with which we can be most of the time sure that the baby is going to be free from the genetic condition under question. And there are different types of this pre-implantation genetic testing in itself, depending upon the condition which we intend to test. And the other one which we had discussed earlier, that is done during pregnancy, can be again broadly divided into screening techniques and diagnostic techniques. Screening techniques is we screen every pregnant patient for the presence of any genetic condition through blood tests and ultrasound scans. But the problem is these screening tests are not 100% true of the actual condition being present. Meaning that sometimes the test may show the condition to be present, but in reality the baby might not have been affected with such condition and vice versa. Hence, this test further, if they turn out to be at high risk, if they show that the baby is at high risk of having such condition, then we counsel the parents and further take on to diagnostic testings. And the diagnostic testings involve taking a sample of the placenta or the fluid around the baby, depending upon the pregnancy age or the gestational age in which you are in. And hence the test can be carried out and the results can be available to make out if the baby is actually affected with such condition. And hence parents can be at a state where they can make a decision regarding their pregnancy. Hope this has added some broader overview and regarding the testing conditions that are available. And hence we usually advise, if there is any query, you can definitely have an open talk with your healthcare provider and then we can take it from there. And also during pregnancy, once your pregnancy turns out to be positive, definitely consult your obstetrician and then discuss about the ways for testing throughout the pregnancy. Happy parenting.